start by washing my hands. Then I'll introduce myself to the patient. Hi, my name is Bethel. I'm a student. I've been asked to examine your knee joint. May I confirm your name and age, please?
I'm Joshua, 30 years old.
Thank you, Joshua. So, the knee exam will basically involve you walking for a short distance while I assess your gait. I will also inspect your knees for any deformities, any fusions. I will also palpate and perform certain movements on your knee. Is that okay?
Okay.
Okay, thank you. So kindly just stand and walk for a few steps and back. So as he walks, I'll be assessing for the gait. There are no gait abnormalities. So next I will move to inspection. So I will inspect the quadriceps for the muscle bulk. I'll inspect both knees for any swelling, any toe deformities. Then kindly just face the wall. So here I'll also inspect for gluteal muscle bulk, hamstring muscle bulk, inspect for any hindfoot deformities. I will also inspect for varus and vulgum deformity. No such deformity is present. So kindly just lie on the couch, head here, and your feet on the other side. So I'll move to inspect for any swelling while prone. There is no swelling. Any scars? There are no surgical scars. So next will be feel for the patella. So I'll feel for the patella. Bilaterally. Then I will check for temperature differences, which is common in conditions like septic arthritis of the knee joint. I will proceed to rule out any effusion. So this will basically involve me sweeping for any fluid and bringing it to the suprapatellar pouch, and then trying to sweep in the lateral side to see if there is any effusion. So I will proceed to do the same on the contralateral side. So there is none. I will also perform a patellar tap, which is used to rule out large joint effusions. So there is none. Kindly flex your knee and just bend your knee at around 90 degrees. Bend it as far much as possible. So the usual range of knee flexion is around 140 degrees. Then elevate it. So try to lift it up with the knee straight. So the usual range of hyperextension is around 10 degrees. Anything above that is abnormal. So I will do the same for the contralateral knee. Then you can bend this knee kindly at around 70 degrees. So I will palpate feel the popliteal fossa, feel the tibia tuberosity, feel the patella, feel the quadriceps tendon insertion, feel for the lateral collateral ligament, and also feel for the medial collateral ligament. So I'll proceed to do special tests which test for cruciate ligament injury. So the first test is the anterior and posterior drawers test. Kindly flex this to around 90 degrees. So I'll proceed to do the same on the contralateral side. Then a similar test to anterior and posterior drawers test is the Latchman's test. The only difference is that in the Latchman's test, the knee is flexed to around 20 to 30 degrees. So with the knee flexed to 20 to 30 degrees, I will use my left upper limb to stabilize the thigh, and then so there is no cruciate ligament laxity or tear in the right knee. I will do the same on the left knee. So next will just be to check for the collateral ligaments. So then I also do the same on the left knee. So Joshua, my examination of your knee joint is complete. Kindly stand or have a seat. So today I examined Joshua, a 30-year-old. I checked for any scars, any joint effusions, they were none. I checked for any deformities, genu-varus and genu-valgum deformity, there was none. I checked for any hindfoot deformity, there was none. The gait cycle was okay. The anterior and posterior drawers tests were negative. The Lachman's test was negative. McMurray's test was also negative. So this is a normal knee joint examination. To complete my examination, I would love to assess the joint above, which is the hip joint, and the joint below, which is the ankle joint. I would also love to assess the neurovascular status of the entire lower limb, and also to check any radiological images available. Thank you, Joshua.